Good afternoon. I'm Cindy from CPSE, and I'd like to welcome you to today's webinar from the International Association of Firefighters, Forecasting and Interpreting the Risk, a Quantitative Approach. It's a pleasure to introduce Dr. Francesco de Bernardis, who has worked as a data research analyst with the IAFF since 2017. Francesco received his PhD in physics and astronomy from the University of Rome in 2010. He worked as a research associate at the University of Irvine and Cornell University. He develops clean software to clean and organize data, forecast fire departments' performance, and conducts GIS and workload analysis. He is part of the team that developed the risk assessment method currently used by the IAFF. If you have any questions during this webinar, please type them into the chat window in the GoToWebinar panel on your screen, and they will be either answered at the end or during the webinar. This webinar is being recorded, and you will receive an email with a link to the recording so you can share it with others. At the end of the webinar, please contact the IAFF directly for additional information, and be sure to visit their booth at the 2021 Excellence Conference, March 2nd through 5th at the Caribe Royale Convention Center in Orlando, Florida. Thank you all for attending, and now Francesco will begin the webinar.
Thank you, Cindy, for the introduction, and thanks everyone for joining today. This is a method that we developed at the IAFF. John Celmer is a GIS analyst at the IAFF. We work together on this method, and he's also online today. Our goal when we built this approach was to develop method that fire departments could use to assess the risk in their community. So to start, just a few words about the IAFF. The IAFF was founded in 1918. It represents more than 320,000 full-time professional firefighters and emergency medical personnel. And our members protect approximately 85% of the population between United States and Canada. The IAFF provides a lot of services for its members. There are different departments. There are different ways that we assist our members. In particular, John and I are part of the Fire and EMS Operation Department. What we do is to provide technical assistance for our locals when they, for example, need additional resources, or they want to figure out if they need to relocate a station or add resources to their stations. So what we do, we look at their jurisdiction, we do geographic information system analysis, we look at their CAD data to understand their demand, and we provide recommendations based on data analysis and GIS analysis. Other examples are EMS integration. So if a fire department wants to add an EMS piece to their fire response, we do that. Other examples also are department mergers. When we have different departments merging, of course, there is a lot of planning that goes into that, and we provide recommendations for how to do that. And of course, all this work is based on industry standards. So we look at the performance of the department, we look at where resources should be placed in order to help the department meet the objective of industry standards. There are different industry standards. One that we use a lot is Nfpa 1710, which is the standard for the organization and deployment of fire suppression operation and EMS operations. These standards come from fire leaders and firefighters working together with data analysis and combining their experience on the field with the evidence that comes from scientific studies. For example, there is this EMS study which was made by the IAFF in cooperation with various institutions. And there are also these NIST studies which looked at the fire ground field experiment for residential and high-rise buildings. All these studies looked at how the efficiency of the response changes when you change, for example, the number of firefighters on an engine, or when a response is delayed for any reason. So the Nfpa 1710 standard is based on the experience of people on the field, as well as on these studies, and all the numbers that are in the standard are supported by these studies. A typical example, a lot of people I know might be already familiar with this, but a typical example is the travel time objective, which is a metric that we look at for a lot of our studies. Nfpa 1710 says that the first engine, for example, should be on the scene our fire incident within 4 minutes for at least 90% of the incident. That's a typical metric which is supported by these studies. And of course, when we do this kind of analysis and when we provide recommendation, a lot is based on the analysis of the risk in the community. There are standards which look at risk assessment too, in particular Nfpa 1730 and 1300. These standards mostly answer the question, what if some type of incident is going to happen in this part of the jurisdiction? How are we going to deal with that, and how can we prevent that incident? Then there is a second question, which is more focused on predicting the risk. So it's where are things going to happen and why are they going to happen there? Why are they likely to happen there? In this presentation, we are going to focus more on this second question, but of course they are related, because if we can say where things are going to happen and why there is a risk of something happening in a certain part of your jurisdiction, then we can also say how we can mitigate the risk and prevent the risk. So what we wanted to do was develop a solid quantitative approach to predict the risk. We wanted to develop a method that could be applied to any community, but taking into account the differences between different communities. So we were looking for an approach that was reliable and that could be applied to as many communities as possible. An important part of this process is to have the labor and management working together, and I will let John speak for this part. Go ahead, John.
Thank you, Francesco. So when we initially talk to our members and inform them about our risk assessment, how to request a risk assessment, we always start off by explaining the importance of keeping all parties involved informed of the status of this project, what this project entails. We want not only the membership to be involved, but we also want fire department administrators, city leaders, decision makers, and the community to understand what's going on. So beginning with that is communicating, understanding what others are interested in finding out. It's going to help us establish our scope of the project. Are we looking at fire-related incidents, EMS-related incidents, rescue, hazmat? Or are we going on a smaller scale of cardiac arrest, overdose, commercial fires? Being able to obtain this knowledge allows us also to identify other data sources out there that we might not know of. So by incorporating all parties, you might be able to gain more information to help you with your final product. And it's always important that everybody understands the methods behind it and how the results came to. They need to have a background of when they see this area is categorized as high risk, a fundamental understanding of what does that mean and how was it concluded. And then finally, it's important to know who your audience is and how you're going to express that information. Is this going to be an in-house department only, where the fire administrators, all they want is a report? Are we doing a social media, presenting it through social media? Is this going to be presented at city council? So knowing that forum will help us at the IAFF best create the project for your particular needs. Next slide, please. So just going to do a quick go through of the workflow. So first, we got to collect data. So primarily, we gather our data from Census Bureau. We have some parcel data, data on your structures, building type, and then your incident data, CAD, and RMS data. Usually, we ask for between 3 to 5 years of data for us to take a look at. Once we have all that data, we kind of need to clean, and focus our data set. So if we're at a particular geographic boundary that we want to look at, we want to make sure our data is only consists of data metrics within that particular boundary. The biggest part with cleaning data is when it comes to your incident data. We want to make sure there are no duplicates of runs. If there's any issues with address or lat long location, it would be inaccurate to use those. So once we have our data and we merge them together, so we have our characteristic, demographic, socioeconomic, as well as historical incident data, we're able to run a regression analysis to identify the relationship between these different factors and demand. So does this particular demographic have a strong correlation between the demand in that area? So after we run our regression analysis, based off of those factors or demographic, socioeconomic variables that are strongly correlated to demand, we're able to pull those out and then identify those as risk factors. So these will be certain variables and information that has a direct correlation between is demand increasing or decreasing. Next, using those results, we're able to calculate what the probability of incidents occurring in the future. So based off of the regression analysis and the coefficients of the strength of those variables, we're able to predict and assess a probability of incidents in the future. And then finally, as we're evaluating this geographic area, we assess risk based off of that area and that area alone. So we're able to assess different levels of risk and then categorize them. So I mentioned collecting and preparing data. So let's look at what kind of data sets are out there that we use. So census data, some examples are population information. So this could be population density, population growth, age, race, gender. We also look at education information, such as percent of the population that has a bachelor degree or higher, or percent of the population that has not received a high school diploma. Health information, percentage of the population that may have a disability. Look at insurance. So do they have insurance? Are they using Medicare, Medicaid? And then also income, we're looking at medium income or those that live below the poverty line. We also look at physical characteristics. So this will be the age the building was built, the size, square footage, number of levels, the height. We also look at structural material, how it was built. And then also parcel data. So we're looking at zoning. Are there heavy areas of vacant lots, primary industrial, commercial districts, and then also square footage or the size of those zoning blocks. And then I mentioned the CAD and the RMS systems. The CAD, we're looking at the type of incident, so maybe it might be defined with MFIRS codes or department's own criteria, as well as the location of the incident, and then also the type of unit and unit that's responding. And then with the RMS systems, it's where we gather a little bit more information on property loss, content loss, and then civilian and firefighter injury or fatalities. So those first two steps, collect and prepare the data. So this is a example of what it looks like when we have all our census data brought in. Each row is its own geographic boundary. This is used at the census tract block group level. So using census files that we've obtained, we're able to populate each of those geographic boundaries with its own unique variable or number. Then next we take the property data we have and we merge that into join those into the same geographic areas. So this is looking at 5 different types of buildings: single family apartment, commercial, service, industrial. And then finally, we pull in the historical incident data, your CAD data. And here we're looking at structure fires, and the department defined their structure fires as either an apartment, building, dwelling, or high rise. So we take those 3 different data sets, merge them together. So each geographic boundary has 3 different sets of or more sets of data. And now it's ready to go through a regression analysis, which Francesco will describe.
All right, thank you, John. So We have all the variables that John described. There are tens or hundreds of variables that we could use. So how are we going to use them? Well, there are, of course, variables that we know are related to the risk. For example, this is a map of Manhattan. You can recognize Central Park, it's that light stripe in the middle. And this is the number of buildings built before 1979 in this case. We know that older buildings that were built before safety codes or that lack maintenance usually have a higher risk of fires compared to modern buildings. So we would expect to see a relation between the number of older buildings in Manhattan and the number of fires that happen there. When we compare with the actual map of fires, which is the map on the right, we see that there are things that we expect. For example, this part of Manhattan has a quite high number of old buildings, and there is also a quite large number of fires. However, if we take this second part on the right side of Central Park, we see that there is pretty much the same number of old buildings, but the number of fires is quite lower than the previous area. And things get even worse if we look, for example, at this other part in the south of Central Park. We see that there is a lower number of buildings built before 1979, but actually a higher number of fires. So we are going in the direction which is opposite to what we would expect. And finally, this area has more buildings built before 1979, but an even lower number of fires. So what's going on here? Are we wrong in thinking that the number of buildings built before modern codes could be related to the number of fires? Well, of course, no, but the issue is that there may be other variables that are driving the number of fires that is happening in a specific area. There could be more than two variables. The situation might become quite complicated pretty quickly. For example, here we have the usual map, the actual fires that have occurred in Manhattan in the last year. And we might think that maybe we can look at the total population. The total population typically is not a particularly interesting variable for a data analyst because obviously where there are more people, there are more things happening. But anyway, in this case, there doesn't even seem to be a particularly strong relation between the total population and the number of fires. However, Manhattan is a very dynamic community, and if we look at the map of the daytime population, we see that there is a quite big difference in how the population is distributed during the daytime. And we can see that maybe that part of Manhattan where we have a high number of fires might be related to the total daytime population. This is a very basic example where we consider two variables, the number of buildings and the daytime population, but there could be many more variables at play, and some of them might be pulling the number of fires in opposite directions. So fortunately, we don't have to think about this by hand. There are statistical methods to take into account many variables and see how they relate to the risk. These statistical methods allow us also to say which variable is more important. Two variables might be causing an increase in the number of fires, but one of them might be actually much more important than the other. Or two variables might go actually in the opposite direction. So the regression is a method that allows us to find a relation between the number of fires and these various variables that we have collected, as John described. And what we are looking for when we run a regression is a pattern in the data. In this chart, we are looking at the number of fires on the left and, for example, the number of households below poverty. Each point is a district in Manhattan. And we can see that, sure, there are fluctuations, but there is also a pattern between the variables, within these two variables and the number of fires. Now, when we look at many variables, it is hard to display all of them in a single chart. We can attempt to put them side by side. For example, we can look at, again, the number of older buildings, the population below poverty, the number of vacant units. The idea is that we are looking for, in general, for a pattern that connects all these many variables and the number of structured fires in this case. So when we run the regression, we finally get a predictions on the expected number of incidents in each census tract or whatever block that we are using, whatever geographic area we are using to break our data. And of course, the predictions will never match exactly the reality, and they would also be completely useless if they did, because we don't want to match what we saw in the past. We want to be able to say something about the future. So we shouldn't expect the predictions to match what we saw in the past. And once we get these predictions, we can also say, as I said before, not only which variables are more important, but also two variables might be important, but also one of them might be more important than the other. So we might plan some prevention initiative to try to reduce the risk in a specific area of the jurisdiction. So one thing that a lot of fire departments like to do is to categorize the risk in simple categories, for example, low, medium, and high risk. That's understandable because it's a very simple way to describe the risk in the community, even especially if you are presenting results to your community, to your citizens. It's much more intuitive to say this is a low risk area, this is a medium risk area, and this is a high risk area. So I want to spend a few minutes talking about this process because it's very popular and very used. The thing to keep in mind is that when we run the regression is not going to tell us what is low and what is medium and what is a high risk. We only get the prediction of the number of structure fire incidents, for example. What we can do is, for example, to put all the census tracts, in this case, in line, starting from those with the lowest number of incidents up to those with the highest number of incidents. And the first 33%, we can call it the low risk census tracts. Then the next 33% will be the medium risk, and the highest 33% will be the high risk. So in this case, we would have the same number of census tracts in each category. Of course, there are some limits in doing this. For example, if you look at the two census tracts between the low risk and the medium risk, the blue bar next to the orange bar, you see that they have essentially the same number of incidents, but they are in two different categories. So this is where the knowledge of the field and the local leaders might go and adjust these categories based on what kind of risks are in each census tract, if they are commercial areas or residential areas. So these are not fixed categories. They can be adjusted based on the specific situation that we have on the territory. Another possibility that we have used in the past is to start to sum the number of incidents expected in each census tract. And when we hit the first 33% of the total incidents that we expect in the community, then we call that the low risk. Then when we hit 66%, we call that the medium risk. And finally, the census tracts that altogether amount to the top 33% of the incidents, then we call that the high risk. This is a more conservative approach in the sense that I can flip back to the previous one and the next one. You can see that there are more census tracts in the low risk category. In this sense, it is more conservative because you need more incidents to go to the next category. But these are both valid approaches. The important thing to keep in mind is that there is not a single way to do this, and it is very important to look at what is happening in the community. When we make those categories, then we can finally produce maps like this. In this case, we have various census tracts. The green ones are those with low risk, the yellows are those with medium risk, and the red census tracts are those which have high risk. You can see that there is a pattern. In this case, the west side of this is Camden in New Jersey has a higher risk of fires. And based on this map and on the location of the resources, the current location of the resources, we can make recommendations about, for example, increasing resources in a specific area, or we can identify areas where it would be appropriate to have more prevention programs. And we can also inform the public about the risk in the area where they live. One quick thing that I want to clarify is that all these examples that I've been showing have been for fire incidents, but of course, we can repeat exactly the same process for any type of incident, even for generically EMS emergencies. This is a map of Nashville, for example, where we did the same thing, but looking at the EMS risk. The variables that are important for EMS risks might in part overlap with those that are important for fire incidents, or might be different. Some of them will be different actually, but the process is exactly the same. We run a regression using all the variables, many of the variables that John described, and we find those that are more important for the risk. So the next step when we have all these maps and when we run all this process will be to implement prevention programs, and I'll let John talk about this.
Thanks, Francesco. So Francesco just showed you the process of how we go from initial data to conclusions of risk, where that might be and what type of risk. One of those things we determined throughout that process was what type of demographics or characteristics or factors are reflected of high demand and low demand. And we call these risk factors. So we should be able to, we use these risk factors to make decisions. Fire prevention, one of the examples is the age of buildings. Maybe once a month in these certain areas of older buildings, we go door to door and check smoke detectors. Low income areas, they have higher overdose. Let's talk to the health department, maybe start some new programs in those areas to bring awareness of, rehab classes, or get the information out there of ways that we can prevent these certain trends from occurring. And it also helps when you communicate with your citizens of your community. If you're talking to your elderly population, you can show them how there's a direct correlation that, we have more EMS medical calls in this certain part of the community because of the high elderly population. So we're not only calculating where certain risk levels are in relation to the geographic boundary of your city or community, but also what are those characteristics that are driving higher or lower demand. Next. So in our risk assessment so far, we've just focused on looking at factors that contribute to a high probability of incidents. There are in other risk assessment models that look at impact and consequence. So impact will be covering the number of units that are respond to a certain area, the number of personnel, the type of units that respond. And then consequence looks at economic damages or economic loss, and then injury and fatalities. So there are risk assessments that incorporate those into their total risk level or risk score. For our model, we leave that separate just because one department's response to certain incidents could be very different than the other. And defining a numeral value of what's more important, economic loss or civilian firefighter or injury or fatalities, there's no statistical method to determine what that value should be. We believe it's important to analyze it and look at it, but we don't believe, and our model doesn't incorporate that in those risk scores that we identified earlier. Next slide. So this is kind of looking at how an area with a high probability of incidents could actually become a low risk if the consequence that the community or the department defined will lower the importance of that area. And our model doesn't factor that in. We're looking strictly at the probability of incidents occurring in the future based off of those variables that we've mentioned. We'll note that by request, or we'll offer to do impact and consequence on a linear one by themselves, with impact being more of a workload and response procedure. So where are travel times longer, where are we sending more units, and using that to create its own low risk level. So these areas should expect a more impact on the department with more incidents and more resources going there. And then as well as consequence, that's a communication that we'll have with the local and interaction with the department of how they want to evaluate that. Are we looking at just property value? How do they want to categorize that? But just to wrap it all in, that we leave that outside of how we assess our risks. Right now, our model looks just on the characteristics and the variables throughout your community and how demand is, the relationship with demand and those characteristics. Next slide.
All right, I think I can continue from here. Thank you, John. All right, so I would like to take one quick step back and go over something that I briefly mentioned already. So we are looking at trying to predict where incidents are going to happen. One obvious question may be, well, we know that incidents will keep occurring more or less in the same areas. Why do we need to run this regression? This is an example of, again, Nashville. We're looking at the concentration of EMS incidents, where red is higher concentration, blue is lower concentration. And if you look from year to year, there are some differences, but pretty much the map looks the same. So why do we want to run a regression and predict the number of incidents in the future? There may be many reasons. One, John already talked about it, is to understand which variables are driving the incidents, so we can then make some plan, make prevention initiatives. The other reason is that a city, of course, might be evolving. We might have new developments, new buildings, new areas that are being built, and we don't have data there, so we can't look at past data just because there was nothing before. So we need to be able to say something about that area anyway. And that means that if we can know at least what kind of areas is it going to be? Is it going to be a commercial area or a residential area? And if we can say something about also the demography that we expect to have in those new developments, then we can apply the regression results to that area and predict what the risk is going to be. And again, there is the prevention factors. There are different factors. Some of them might be important for a community. For example, poverty might be important in driving the EMS emergencies in one city, but it might not be that important in another city, even if in theory we know that there is a relation. But with this approach, we can be specific and look at a specific community and implement specific prevention initiatives that are optimal for that city, for that jurisdiction. So to give you a very practical example, we had, for example, this local, which is Clark County in Nevada. The points are the incidents that they had in 2018, I believe, and the color scale is the population growth that they expect in the next 4 years. You can see that there is an area which doesn't have any points. This is because it's an area that it is being developed right now. They are expecting a quite significant population growth between 4% and almost 12% in the next 4 years. And the local asked us to evaluate what the risk will be there and what kind of resources they will need to add. And of course, without data, we don't have, you can see that there is no point there. So without data, we cannot just say, well, more or less you will expect the same number of incidents. We need to be able to predict what is going to be. And this is a typical example where this approach might be useful, for example. Another case, which is more extreme, is this small local in Canada. This is a town with 8,000 people. They have 2 large industries, an aluminum smelter and a natural gas facility, which are expanding significantly. They're expected to have something like between 5,000 and 7,000 people coming to work in the city, which means they will essentially be doubling their population in the next less than 10 years, actually. So the risk is going to change a lot in this community. And it will be important to predict what is going to happen and where resources should be placed to face this new situation. The previous data don't describe this situation because they were based on a completely different community. So we can apply that approach to this case, for example. I like to show this case because this extreme case is also a good example of the limits of this method. There is no statistical method which can always describe the reality perfectly. And a small local like this might be maybe a situation where the method as it is cannot be completely applied without some significant discussion with the local. This case is very specific. There is not much data available. They don't have, in general, it's a small community, so they don't even have that many incidents. So it might become hard to actually run a regression on a case like this. Or we could attempt, but then surely there would have to be a very specific discussion with the local and with the local leaders to understand where resources should actually be placed. In a case like this, we might not be able to trust the method completely. However, there are ways to improve the method and to make it more reliable, even for extreme cases like this. So far, we have been using this method for specific communities, and especially on the larger towns like New York City or Nashville, because we have more data there. Of course, we could apply the same method to the entire United States. There are approximately 74,000 census tracts in the United States. The National Fire Incident Reporting System provides data about the incidents that occur every year in the United States, approximately 27 million in the last year. So this is a lot of data, and that means that when we have a lot of data, we can start to apply more advanced processes. We can apply maybe some machine learning method, and this will enable us to say a lot more, even about smaller communities. An advantage of this approach is that we will be able to use more variables. In general, the number of variables that we can include in the regression is limited by the number of data that we have available. With so many data, we can include many more variables, which means that we could also be able to produce more accurate results. On the other end, there are also complicated aspects in this approach. For example, we have vastly different communities in the United States. We have a city like New York City, and then maybe a small rural community in the middle of the United States. And of course, they are very different. The risk is very different, and the variables driving the risk will be very different. So one possibility is to split the data in communities of different types, dense urban areas, rural areas, and run these machine learning approaches on different categories of cities, for example. Of course, when we do that, we have to be careful, because if we make too many splits, then we will be actually reducing the number of data that we have available. So there is a compromise between accuracy and the ability to actually use advanced methods. But anyway, this is we believe that this is a quite promising approach, because if we can use this approach, then we will be able to say something even about communities where we don't actually have data, either because they are too small or because they are changing dramatically, like the example that I showed before. So this is what we are working on right now. Feel free to ask any questions. This is also our contact information in case you think about any questions after this presentation, or if you want to reach out to us to ask any more specific details, feel free to do that. And thank you for listening.
Okay, we've got some questions here. I'll just read them to you. I'm interested in the status of the Fire Cares initiative. Will it continue to be funded? I just logged on and noticed that the last data import was in 2016. Fire Cares is also, of course, an IAFF-sponsored community fire risk assessment application.
I actually don't have information about that. I don't work directly on that, but I can find out and maybe forward some information. I'd rather not say something inaccurate.
Okay. So Jim, just go ahead and maybe email your question. And for everybody, if you don't get your answer today, I recommend you email them and they'll forward them on to somebody else that, if they can't answer it. Second one, also from Jim, is regarding your combining the data section. Do you have the ability to document occupancies with built-in fire protection systems as part of the fire risk assessment algorithm? Regarding your adding variables section, do you have the ability to document occupancies with built-in fire protection systems as part of the fire risk assessment algorithm? Maybe same question I got, or same, yeah.
Yeah, I'll take that one. It's all based off of if the data is available, we'd be able to merge it in. So if we had the data, which of like structures that have these certain characteristics that you mentioned, yes, we'd be able to incorporate that in there. But it's just based off of what data is available. So hopefully that answered your question.
Okay. What data didn't you have access to that you wish you could have?
Well, when we're asked to do stuff with consequence, patient outcome, we don't have. If we had patient outcome, then the severity of a medical incidents, we could kind of rank it a little bit. So that's hard when we don't have that. And then when certain communities, if they don't provide us or they don't have development or future development areas, is this a new factory getting built or retirement homes? Without that data, then we can't incorporate it, as Francesco was mentioning with that one example in Clark County, is, say that instead of that being a population growth, say that that was going to be a new Amazon center. Without that knowledge, we wouldn't be able to add a little bit more influence to that area and project out what kind of demographics and characteristics that area would have in the future.
Okay, is there a cost associated with these studies?
So these studies we provided for our members, so there is no additional cost. It's just our members, our locals can come to us and say, we need a risk assessment, and it's just part of the work we do for our locals. It comes together with the workload analysis and GIS analysis that we normally provide. So no, there is no cost for that.
Okay. Will IAFF share further details for the risk assessment approach and modeling for the agencies to follow on their own?
We can certainly provide recommendations on how to implement the method. Yeah, that's again a discussion that we can have with the local, and we can guide them through the process. Again, this is something that we provide for our locals. So yeah, it's something that we can guide them through.
Okay. When accounting for impact in the CRA in this model, is impact measured on the community or the response system?
Impact on the response system. So how is certain areas in your community putting stress on the response? So if you have a certain area where a lot of units are responding outside their first due to respond to this one particular area in your community, we'd be able to use that to assess if that area has a higher impact on the overall department because resources are having to respond outside their first due to provide additional assistance. So yes, it's on the department, impact on the department.
Okay. I think, Alan, part of this has been answered, and I'm not sure I've got this clear, but do we go through our local to assess the service? So I think there's a word missing. Let's see if he'll respond.
If that's in reference to a project request, if you reach out to your district vice president, he or she will reach out to the Fire and Mess Operations Department, and our director will reach out to the local president and start the process of getting a project assigned.
Okay. What is the time frame to complete the assessment and the current backlog of requests?
Well, that's hard to estimate, unfortunately. The process itself, the risk assessment by itself, is not a particularly long process. Of course, it depends on how many are in the line, and that's unfortunately a question that it's always hard to answer. But the process itself, the analysis itself, even for larger locals, shouldn't take more than a few weeks once it is started. The question is, when are we able to start it?
I would add on to that, Sydney, available data and cleaning up the data, depending on the quality that we receive it or how we find it, greatly depends on the extent of the time span of the turnaround for the project.
Okay, very good. All right. Has the IAFF looked at any Canadian agencies since the census data that is available will be different than the USA?
I don't think we have worked specifically on this regression approach with a Canadian local, but it's really not a big difference. Whatever geographic unit we can use in, for example, for a Canada local, we will use it. It doesn't have to be a census tract, and whatever data we can find, it will be used the same way. So as long as we have variables that we can relate to the risk and some geographic unit that we can use, the method is absolutely general. It can be applied to any local, even in United States, Canada, doesn't make a difference. Yeah.
Okay. I am a 23-year member of the IAFF. I am the fire chief of a volunteer fire department that does not have a local. As an IAFF member, can I get this study done for my volunteer fire department, or can only my local request it for my career fire department?
Only the local for the career IFF department.
Okay. What is the normal turnaround time on the process if it went into queue today?
Yeah, so as John was saying before, once we receive the data, the analysis by itself doesn't take long. The problem is, of course, how many projects are in the line. Usually, unfortunately, there is a quite a long waiting list. So it's hard to provide an estimate, but once the project is started, which means that we need to have the data available, then it doesn't take more than a few weeks to complete the analysis. But again, the whole time, the entire time interval depends on how many projects are in the waiting list. And unfortunately, I really don't have an estimate on that.
Okay. What are the tools that
Cindy,
you... Oh, go ahead.
Just one last thing. Like Francesco with the turnaround, couple of weeks for the actual process, but it also depends on with the organizing with the local, how responsive they are. When trying to figure out what type of incident is this, what would you like this categorized? So the more attentive they are on getting back to us when we have certain questions, definitely can speed up the process.
All right. What are the tools that you use? ArcMap, Power BI, etc.?
So yeah, there is the Esri GIS package that is used for collecting the variables and mapping the results. The regression analysis at this moment is made through Python. So it's writing some scripts using some statistical packages in Python. And then we take the results and we put them back into the Esri products, either ArcMap or ArcPro, and we produce those maps that we have shown.
Okay. So Fairfax County used this process, and it can be reviewed in their CRA SOC on their website. Rich Merrill just wanted you all to know that these guys did a great job and taught the whole staff along the way. So if you all want to view that, it's on the Fairfax County website, CRA SOC. And I think that's it. If you have any questions, please type them in quickly. All right. So as you all can see, their contact information is there, their emails. Please reach out if you didn't get your question answered or you come up with something. And I want to thank the IAFF for today's webinar. It was very informative. Thank you guys so much. And we will have another webinar next week. So stay tuned to CPSE. Thanks, guys.
Thank you, everyone.
Thank you.
Thank you. Bye-bye.